Everyone has heard jokes about hospital food, but to the frail elderly, proper nutrition and hydration is no laughing matter. Good nutrition helps fight infection and heal tissues. For elderly patients, adequate nutrition and hydration can also help prevent confusion. Even patients who describe proper eating habits may be dehydrated or malnourished on admission. Both states can lead to a host of health problems.
The goal of the Feeding Assistance Program is to try to maintain the older person's nutritional status throughout hospitalization.
In the elderly patients, it's really important to maintain their nutritional status. For one thing, eating is comfort to them.
There are several different levels of feeding assistance that we have in the Elder Life program, and they range anything from just companionship to setup during meals, which means that the volunteers will just assist with opening containers, laying out the silverware, laying things out so that it's easier for the older person to work with. Cutting up some food might be another setup activity. And then there's other gradations where they can provide just minimal assistance or more assistance, and then a full feed where the patient is actually completely fed by the volunteer.
90% of our patients fall in the category of just encouragement. And what the volunteer does is provides a setting where it's more like a natural eating situation.
Within all 4 levels of feeding assistance, volunteers can perform a number of tasks to help patients. One of the simplest tasks is helping patients make food selections from the hospital menu. Many elderly patients make random selections or no selections at all simply because they have difficulty reading or even reaching the menus. Volunteers can help be sure patients' special dietary preferences are met by notifying the Hospital Elder Life Program staff or floor dietitian. Always check with the nurse before beginning mealtime assistance, because last-minute changes by a doctor for an upcoming test or procedure may mean the addition of food or liquid restrictions not previously noted.
But he just asked me for some water, and so I was a bit confused. Shall I give him some?
Yes, you can give him some, but please account for it on his intake sheet.
Oh, okay.
Thank you.
When assisting patients at mealtime, volunteers should follow a few general guidelines. Always wash your hands before setting up a tray or helping the patient eat. And be sure to check the items on the tray against the menu.
Is all of this for me?
Well, let me check, Mrs. Mosley. I'll look at your menu here. And yes, your name's on it and all the things you've checked, so anything on here is for you.
If the patient wears glasses, make sure the patient has them on. Seeing better makes selecting what to eat easier and feels more normal.
Do you have your dentures in, Mrs. Mosley? Okay, good.
Likewise, if the patient wears dentures, encourage them to put them in. Ask for a nurse's assistance if necessary. Patients may not have had time to get their dentures before coming to the hospital, and if friends or family have not yet brought them, the volunteer can see that soft food is brought in. If a patient is wearing oxygen prongs, this does not interfere with feeding, and they should not be removed. However, if the patient is receiving oxygen through a mask, check with the nurse before removing it. Explain what you're going to do while you assist. This is an easy way to keep conversation going.
Let me straighten your pillow out a little bit so that you're sitting up a little bit.
Volunteers should help patients to sit as upright as possible, whether in a bed or in a chair, to minimize the risk of choking. Ask the nurse for assistance if necessary.
Just maybe a little bit to the right.
Okay.
Adjust the tray table to a comfortable height in front of the patient and place the call bell within reach.
Okay, I'm going to move it down closer so that you can reach it with your hand. Then I'll pin it to the sheet. Here you go.
Ask if you can help place a napkin across the patient's chest or lap.
Would you mind if I pulled up a chair and talked to you a little bit while you eat?
No, I would like that.
Through your friendly and relaxed manner, you can keep patients focused on the task of eating. You may also be asked to encourage fluids.
Do you need to rest a minute, or would you like to finish?
While you should provide encouragement to patients to keep eating, let them set the pace. Do not rush them. When setting up a tray, volunteers will help remove all covers and unwrap utensils without touching any surfaces that would go into the patient's mouth. Volunteers will open cartons and insert straws in dietary supplements or other drinks. If a patient has difficulty with tasks such as cutting up food or buttering bread, the volunteer can help with this as well.
Sure, let me help you get to that a little
Help
bit.
visually impaired patients by telling them where items are located on the tray. The volunteer should be observant for other ways the patient may need assistance.
What kind of soup is this?
It looks like vegetable soup.
We try to make sure that if there's any liquids, hot liquids, that we take the lid off and make sure they're cooled down sufficiently before someone handles them. Same thing for the soups, because they can be very hot, and we try to make sure that the temperatures are right.
Throughout the meal, volunteers should be seated facing the patient at about eye level. This provides a better atmosphere for companionship and conversation.
Okay.
But even conversation has to be conducted in such a way that the patient will not choke. Don't ask questions or cause patients to laugh while they have food in their mouths. Be sure to give the patient time to chew and swallow.
My great nephew.
Volunteers should encourage patients to feed themselves as much as possible. This preserves the patient's dignity and maintains a level of independence that hospitalization can sometimes take away. However, for some patients, greater degrees of feeding assistance are needed. Partial feedings might include such things as the volunteer helping to place liquid containers in the patient's hands to avoid spilling, or helping an arthritic patient to grasp utensils. Volunteers need to follow specific guidelines when doing full feedings. Full feedings involve spoon-feeding the patient 1/2 spoonful at a time and allowing time for complete chewing and swallowing.
Would you like to try a little bit of your vegetables?
Volunteers should encourage patients to eat as much as possible.
It's mixed vegetables. It's corn, potatoes.
We try to make sure that they feed people everything with a spoon, because if you're feeding someone, you don't want to be poking those sharp fork tines into someone's mouth. Plus, the spoon serves as a perfect measurement for about how much food you're going to give someone. You don't want to give them too much food at a time, so if you stab something with a fork, you can get a pretty big piece of it that's too hard for someone to eat. And a spoon kind of gives you a natural measure of the pace you want to go at, is how much you want to give someone at a time.
Okay, that's good. I'm going to give you another drink of milk to make sure we wash it down.
Volunteers can prevent choking by offering liquids frequently during the meal and watching to make sure the patients aren't forgetting to swallow. Sometimes confused patients or ones with some sensory impairments unknowingly store or pouch food in their cheeks.
Mrs. Smith, I think you still got some of the roll in your mouth. Could you swallow again for me?
Volunteers should gently remind them to swallow.
Okay, that's good. Mr. Wilson, you've finished your milk, and it would be good if you could drink some more. Can I put the apple juice in a cup for you?
Dehydration is a common problem among the hospitalized elderly. Instructions for some patients may direct volunteers to encourage the patients to drink several cups of fluid during their shift. Volunteers can further help by documenting how much the patient eats and drinks.
You know, there's always water in the water pitcher by your bed.
Oh, yes.
Sometimes we're asked to record exactly how much they ate because there's a concern that the person is not eating. So that's, of course, also that's really helpful on the, sort of this pure medical side. Person only ate half of the mashed potatoes and wouldn't drink anything.
If we see any problems with appetite, the patient stops eating, we want to make sure we document that because nutrition is critical and we don't want the patient to be undernourished or moving into a status of malnutrition. So we need to document that very, very carefully.
During the meal, if the patient has difficulty swallowing, appears to be coughing more frequently, or is short of breath, the patient may be choking. It's important to get help immediately if you think a patient is choking. Use the call bell to get help, remove the tray, and stay with the patient until help arrives.
What's going on, Mrs. Smith?
She was eating and I think she's choking.
Spit it up, spit it up, spit it up. Okay.
Notify a nurse for any problems that occur during feeding, such as difficulty swallowing, spills, or poor intake.
That was good, but I've had enough.
Okay, Mr. Wilson, you did pretty good.
When the meal is over, volunteers should help patients wipe their hands and mouths and assist them in moving back to the bed if they want to.
Step back and just sit on the side of the bed first.
Make sure the call bell is within the patient's reach.
And can I get you anything else?
Oh, no, I just want to rest.
Okay, you take care.
Yes.
Okay.
Thank you.
Volunteers should also wash their own hands before leaving.
It's been wonderful for me to have all the support in this program with the volunteers and everybody doing little things to make my job easier, to make sure that everybody's getting the right diet or the right plan of care.
Volunteer feeding programs have been proven effective in improving the nutritional and hydration status of frail elderly patients. Programs such as this help the patient's recovery and prevent physical and mental decline. You need to remember that every bite counts and that your help can make a difference.